In this video, we're going to talk about genetic testing for heart disease risk. Is it a good idea? Should you get genetic testing for heart disease, and could it save your life? Genetic testing for heart disease risk has been a hot topic for many years. It's exciting to think that we could determine someone's risk for heart disease from a simple blood or saliva test. And knowing the amount of risk someone has for heart disease is important because risk is the primary factor used in deciding the aggressiveness of your prevention strategy. For example, those who are at high risk benefit the most from prevention treatments like statin medications. Those who are at low risk, on the other hand, won't get much benefit from statins. The problem is we don't have tools to help us accurately assess risk. The most common way we assess risk is to add up some of the risk factors for heart disease like high blood pressure, cholesterol, smoking, diabetes, and age. And we usually put these into a risk calculator. The most common being the ASCVD, that's atherosclerosis cardiovascular disease risk score, and we'll put a link to this calculator in the description below. However, there are several other risk calculators. Adding up risk factors works well in a population or a big group of people, but it doesn't always work so well in individuals because there's a lot of variation between us. Genetic testing, if effective, would be very attractive because it would allow us to be more accurate in our risk predictions and determine your individual risk rather than just the average risk of people like you. It is estimated that about 40 to 50% of the risk for heart disease is genetic or inherited, the rest being environmental or lifestyle choice. So it makes sense that genetic testing would be valuable in helping to determine your risk for future heart disease. However, just because it makes logical sense doesn't mean it helps. We have to demonstrate in a research study that genetic testing is better than our current way of assessing risk. Two large studies were published in JAMA, one of the leading medical journals, that answered the question, does genetic testing add additional value over traditional risk factors? And the answer in both studies was no. Genetic testing did not do a better job of identifying those people who are at higher risk for heart disease than the old school way of adding up the usual risk factors. These results are disappointing. Having a simple test that could help us learn who is at higher risk for heart disease and stroke would be valuable. But as it stands now, the current models of genetic testing for heart disease don't make a big enough difference to justify their use in most cases. What does work when the risk for heart disease is unclear, the most common example of that is when someone has a family history of heart disease, in my opinion, is imaging for artery disease with either a CT calcium score or a carotid ultrasound. Not everyone needs these tests, but if you and your doctor are unsure if you are at higher risk, they can help decide how aggressive to be with your heart disease prevention strategy. As of today, genetic testing for heart disease risk doesn't seem to be helpful. But we are learning new things every day, and it will be exciting to watch how genetic testing evolves to help us lead healthier lives. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.